Good afternoon. Welcome to the Foundation's first community briefing of 2025. We are so pleased to have you all join us today. I'm Christina Ciociola, Senior Vice President for Planning and Community Strategies here at the Foundation. I am going to review a few housekeeping items, review the run of show so you know what to expect, and then introduce our speakers. So you are all muted and your cameras are off. We can't see you and we can't hear you, no matter how hard you might try. We are deliberate in creating space and time for questions, and our audiences always have a lot of questions, usually more than we can answer. Please enter your questions in that Q&A feature in the bottom of the screen. It helps us keep track of the questions better. Do not use the chat to enter in your questions. If you have a technical issue, please use the chat to communicate to Carmen. You can also use the chat if you want to type in a general comment or reaction, which people often do. But again, please do not use the chat for questions, because if you type your questions in there, they will get lost. The webinar today is going to focus on community well-being, specifically in three areas. We're going to talk about financial security, entrepreneurship and wealth, and social supports. There'll be some opening remarks and context setting from the Foundation, a brief presentation from DataHaven, then some discussion followed by your questions. I will pop back in to help moderate your questions for the presenters. Again, please put your questions in the Q&A. Once the webinar concludes, please complete the evaluation survey, which should pop up on your screen. These surveys are really helpful to us in planning future briefings and follow-up. You will also receive in the next week or so, you'll receive a follow-up email with a recap of what we learned and heard today, with a link to the recording of the webinar. So with those housekeeping items settled, let's get started. It is my honor and pleasure to introduce the Foundation's President and CEO, Karen DuBois-Walton, who is joined by Mark Abraham, the Executive Director of DataHaven. Karen and Mark, welcome.
Thank you. Thank you, Christina, and welcome to everybody. It is wonderful to have you here with us for our first community briefing of 2025. I am excited to have joined this team in last November and be in this conversation today about something that's very important to the work that we do here and to our entire community of over 600,000 residents in the greater New Haven community, and that is the well-being of our community. So here we are with a new CEO after a amazing 24-year tenure of my predecessor, Will Ginsburg. Here we are sitting, approaching 100 years. We're at almost 100 years as a community foundation of convening and learning together and investing in this community, and working toward our goals of being an ever more connected, ever more inclusive, ever more equitable, and ever more philanthropic community. We are certainly proud to have been in partnership with DataHaven for many of these years, and excited always to bring you this information to help us think about our community. This foundation has consistently been a place of responsiveness to the changing needs in our community. And before moving forward, it would feel improper to me to not note some of what's changing in our community as we speak. It has been a interesting couple of days around here, and certainly a challenging set of days in our community, as things that we hold near and dear around creating a community that works for all of us have been challenged, most recently by threats to federal funding coming into our community. I do want to reiterate the Community Foundation's continued commitment to building in this community, to investing in this community, to convening in this community in ways that align with our pillars of equity and opportunity. And I think as we're all thinking about how to move forward, It's important to be grounded in some of the facts and the data, and have data that we can rely on that helps to tell us where we are, helps to tell the story of the great opportunities in our 20-town region, and also highlight the challenges in our 20-town region. Because I think it's when we're grounded in that knowledge that we have the best opportunity to think about how we as a community want to come together as one community committed to investments and things that will make this a place that actually allows opportunity for all of us. So, in partnership with DataHaven, we have been able to bring to this community information that I hope has been helpful in thinking about grants, in thinking about new programming, in thinking about where you might want to give your philanthropic dollars. And we are lucky to have a partner here in New Haven like DataHaven. And so I do want to bring into the conversation the executive director of DataHaven, Mark Abraham. And Mark is the executive director of DataHaven, and as in that role, partners with local and state and government agencies, academic and healthcare institutions, foundations, and community organizations to collect, to share, and to interpret public information about Connecticut. Today, Mark is going to bring us the latest and greatest on our Community Wellbeing Survey. And I'm going to turn over to Mark and then come back on for some questions and discussions. So welcome, Mark. Thanks for being with us.
Thank you so much, Karen. I'm going to begin with some slides here. And these slides will be posted after or sent out to participants. You can always reach me at the email address here if you have questions about them. Just some warning, I'll be presenting a lot of data, so maybe depending on how fast you read some of this graphs, maybe a little much, since I'm trying to give a sense of what the key trends are, in the region, but also give you a sense of what breadth of information is captured by the survey and why that's important as well. The survey is, a project we've been working on for over 10 years. DataHaven's mission is to empower people to create thriving communities, and that means having data about communities. So it could be geographic areas like zip codes. It could be communities based on people's lived experience or other issues that affect their lives. So, and we do provide assistance on using this data. So if you are part of a nonprofit board or part of a nonprofit, you can reach out for assistance on using the data that you'll see today. Some of the main products you may have seen from DataHaven include the Community Wellbeing Index. That's like a larger report about lots of topics that affect the region. And we're working on the next version of that currently. Our most popular resource is the Town Equity Report. So these are reports that are available for all towns in the state. There's a document about your town on the DataHaven website, and you can look up a lot of facts about the town, kind of in some unique sources of information that weren't previously available at the town level. And then we also have a town data viewer and neighborhood data viewers. Those are also pretty popular for looking up statistics about towns or neighborhoods. So with that introduction, I would say that none of the work I'll present today would be possible without the support of our funders. So that includes the Community Foundation for Greater New Haven, but also many other organizations, public and private, throughout the state that support the survey data collection. The survey that we do, as I'll mention more in a second, is a very resource and labor-intensive process because it involves randomly selecting adults and then doing lengthy interviews with each adult in a very scientific way. It essentially replicates the methods that large government agencies use when they do surveys of the United States. So we have many supporters in the region, including Yale New Haven Health, Workforce Alliance, the City of New Haven, Quinnipiac Valley Health District, and others. And we're very grateful for their support. Also, in addition, I'm grateful for exceptionally talented staff here on the screen. The graphics that I'll share today were generated, mostly by our staff. So just wanted to give them a shout out and a thank you for their work. 2024 represents the 7th wave of the survey. So essentially the 7th time that we've done the survey. Over 50,000 randomly selected adults across all zip codes in the state have participated in the interviews. They have been in both English and Spanish. And this year in 2024, we completed almost 7,500 interviews of adults throughout the state. So the level of data collection is sort of unique. I would say there aren't other large like neighborhood level surveys of this detail in other states. So it does give us the ability to look, by town, by zip code, and across many communities at well-being, health, and economic conditions. We do focus on creating quantitative estimates using sort of validated surveys that are collected nationally and essentially repeating the same questions, in Connecticut, so we can get really good high quality data about, our communities in the state. And they can be directly compared to national statistics in many cases for that reason. And one of the unique aspects of the survey is that it involves an advisory council. So these are members from organizations and just residents across the state who help us select and propose topics to include in the survey. So if you were part of the advisory council this year, we're really grateful for your work to inform the survey design. The graphic here just shows how some of the votes were tallied from that council. So people voted on the questions they wanted, and then, proposals kind of went in multiple rounds. The most voted on question this year in the advisory council was a question about missing mental health treatment and the reasons for not getting counseling or mental health treatment. So we added that to the survey this year. But essentially every year the survey evolves to reflect priorities while also keeping some of the core questions that let us track trends over time. And after the data are collected, we use the 2020 census to apply weights to the results so that they're representative of the total population in any given area. We apply weights for every area, so there's really data sets and crosstabs for the whole survey that are produced for more than 100 different geographic areas in the state. And that ensures that the data are reflective of the entire community. So what the good news is, because we use a random sampling approach, we're selecting people based on randomly selected address or phone number. We don't have to do a lot of weighting. The main exception is with younger adults. So this table is the example of what you might see in one of our crosstabs. It shows for the 13 towns in the greater New Haven area. We interviewed 232 young adults this year. They would be weighted to represent the population accurately. They're weighted as 384 adults in the final estimates. So you'll see here, there are not a lot of weighting otherwise. We do get representative, samples across all different groups, but weighting adjusts for the fact that obviously younger adults might be working more, studying more, having more less time to take a survey, so they're counted more in the final estimates. In addition to the quantitative data that I'll be focusing on today, we also do a lot with qualitative data, and this could be at the point of data collection in our survey where we'll call people back and get questions about what they like about their community. These are some examples from Milford and New Haven. People talked about, really across the state when we did this, the importance of having places to go, like festivals, town events, main streets to go to meet other people in their community. That really emerged as something really important to folks. And then, when we were asking people about improvements, they suggested things like better, easier transportation access and places to build trust in their community. Another way to work with qualitative data is to take the statistics that we generate and feed those back, use those in discussions and dialogues. So that's another approach we've taken in events, including some that are upcoming with the Community Foundation, where data are available, roundtables of residents and organizations can discuss what it means to their community, and then that information can be captured to help interpret the data results. So I'll move on to discussing some of the trends now. You may have seen, a lot in the news about rising concerns with finances. For example, more credit card debt, more credit card delinquency, evictions remaining much higher than they were, prior to the pandemic in some areas. Issues like that. We do see that in the DataHaven survey, where about 40% of adults say that they're just getting by or struggling financially. And that's the highest rate that we've observed in the survey over different time periods that we've done it. In Greater New Haven, you could see for adults earning less than $30,000 a year, 70% say they're just getting by or struggling financially. So the question is why is financial insecurity increasing? Why do people feel less well off? Is it just a matter of having more credit card debt, or are there other factors at play? And if we kind of disaggregate that data, we can see the biggest increase in financial insecurity is probably this issue of housing insecurity, which is the question on our survey that asks people if they ran out of money to pay for rent or pay for mortgage in the past year. And unfortunately, when we started doing the survey, 7% of adults said they had faced housing insecurity or couldn't afford their housing payments. This past year, it went to 14%. So that rate doubled over time. There are just many, and percentages may seem small, but a percentage you have to remember, 10% of adults in the region would be, like many tens of thousands of adults. So this is a very big shift in the data that we see. It does especially affect renters and adults with lower income levels. You can see, for example, for adults earning the median income or a little higher, or earning $100,000 a year, that's the purple line at the bottom of this chart. And reading, from 2015 to 2024, you can see their rates of housing insecurity have increased a bit, but not nearly as much as other groups. And another factor that comes out when you start asking about financial security is the issue of food access and food security. In our survey, we ask a question that asks, whether people ran out of money to provide food for themselves or for their families in the past year. That's kind of a typical way of measuring the issue of food insecurity. And again, this chart shows going from left to right, starting in 2015, going over to 2024. Food insecurity rates were fairly stable, and they dropped, especially for families with children in 2021, which was when the child tax credit was expanded, and there were many other sources of income that helped with that. We saw, lower use of food banks, for example, when that happened, and also, lower rates of child poverty with that tax credit. The credit expired in January 2022, and you don't see that on this chart, but other charts would show that really as soon as the child tax credit ended, the food insecurity rate for families increased dramatically starting in January of 2022. And on this chart, we're just showing Greater New Haven, so just the change up to 2024. But basically, you see this really large increase, especially for adults with children at home. And in Greater New Haven, it's more than 1 in 4 adults with children who report food insecurity. And if you break that down further to look just at the city of New Haven, 39% of adults with children report that they're unable to buy, ran out of money for food in the past year. So just very large increases in this measure. They increased right after the child tax credit ended and other pandemic assistance. But other factors would be important to look at as well, like just the rising cost of food, and also how the cost of housing that you saw in the previous chart, how that offsets people's budgets for food and transportation and other things. Because we have a large survey, we are able to ask more detailed demographic questions, and this is where you can see some of the disparities in any issue, whether it's discrimination in healthcare or financial security or other topics. The survey that we do collects more detailed demographic data than most surveys. So we ask, for example, whether residents had been incarcerated, had that experience of being incarcerated 2 or more times. And you can see on the top here, for example, adults who were incarcerated 2 or more times are more than twice as likely to be food insecure today. You can see other important differences, like disability is a big factor, where adults who have a disability are much more likely to report issues with affording food. Another aspect of financial security, you could say, would be around getting healthcare. And this slide was a bit of a surprise to us. We found that since 2021, lower income adults were even more likely to miss or delay needed medical care. We know that we ask follow-up questions about this topic when we include it in the survey, so we know, some of the reasons why people miss healthcare include just being unable to pay for it, unable to pay for the cost, or insurance not covering it. For the immigrant community, not having insurance at all is a big factor as well. But what is surprising about this chart is that we knew that people delayed care during the pandemic. That's in the middle of the chart here in 2020 and 2021. But after the emergency part of the pandemic ended, people were more likely to be going to healthcare appointments. But what's interesting is if you look again at families with children who are in the red line at the top, or families with much lower income levels, you can see they're even more likely to miss healthcare than they had in 2020, say. So that was a surprise to us to see in it. We don't know if that's due to the cost and the other squeezes on family budget or other factors, but that was a notable difference as well. And I'll talk about entrepreneurship kind of in the context of financial security. So we know we actually added some questions on the survey this year about entrepreneurship, since it was an important topic for many residents, many partners around the state. And this state is also interesting. We could see that 32% of adults in the state have owned a business, and 17% still own the business. And it's kind of interesting how that varies between, say, the outer ring towns of New Haven, so the towns like Madison and North Haven and Milford, and the city of New Haven. You can see in the outer ring towns, adults were more likely to have owned a business at one point in time. It could be partly because adults in those areas are older on average or have more wealth and are able to maintain and own that business. But if you look at the percent of adults who still own the business, it's about the same as it is in New Haven as in the outer ring towns. And then if you look at the other data, adults are about 10% are about likely to be trying to start a business across most areas. And then many adults are considering starting a business, but have waited or have changed their mind. So, and that number is actually much higher in the city of New Haven. You could see 38% of adults in the whole city have considered starting a business at some point. We can break this down by more of the demographics, and some of the interesting findings are that women were less likely than men to have owned a business. That kind of tracks with data about home ownership and ownership of other assets where there's a big gender disparity. But when we look at that last question about adults who considered starting a business, Black and Latino adults in the New Haven area and women were about as likely or more likely to have considered starting a business over the past recent years. So some of the factors that may explain these differences in entrepreneurship and kind of wealth ownership might include just the wealth disparity in general that we see in the community. And I think this chart is one interesting way to illustrate that. We know that adults who are able to get like inheritances from their parents or grandparents, they're more likely to have wealth and find it easier to purchase homes and save money through that mechanism. Within the Latino Black communities, inheritances are much less common, and home ownership is much less common. So you can see on this table here, older adults are more likely to have like a positive net worth. Younger adults and people of color are much less likely to have a positive net worth, and they're about as likely to be in debt as they are to have a positive net worth. And this is based on a question in the survey around, sort of if people were to sell all of their assets, like their car and their house, would they have something left over or would they be in debt? So there are a lot of residents in the New Haven area that report that they are in debt, basically, and especially within communities of color. This tracks sort of with the data around, having owned a business or starting a business. So some of the interesting trends with social support, and social support is important because, as a measure of well-being, just asking people if they have like friends they can rely on or getting emotional support from an organization or from their community, that is highly associated with mental health and being able to get like better job and even stay in college and things like that. So we do ask a question about, if people usually get the support they need from friends and family. One thing that we've seen in Greater New Haven, but also nationally, is that within the highest income demographics, the higher income towns, and among people with bachelor's degrees, the rate at which people say they get social support has actually increased. So that's at the bottom of this table. You can see for adults in the Greater New Haven area with a college degree, 74% said they had support in 2018, and that increased to 77% this year. For the other groups that don't have a college degree, the rate of social support dropped pretty dramatically, and that's something that we see also in the national data around some of the surveys that ask about like whether people have like lots of friends that they can rely on, or if they go out to socialize and things like that. And again, this issue could be related to financial stress, like you know, if you are concerned about paying rent and housing, it gives you less resources to like go participate in a summer camp or to go out and enjoy entertainment and things like that that would provide this support for people. But nonetheless, it is concerning to see this trend. It hasn't been so evident previously that you know, there have been differences in social support levels, but just the idea that it's getting so much worse over time in recent years is concerning, you know, both nationally as well as locally. On the other hand, you know, we do ask people whether they're just like satisfied with their community, if they like living in it. And the good news is like across all the groups I was just talking about. So for Puerto Rican adults, people with incarceration experience, you know, across all groups, generally speaking, the majority of adults, you know, more than 2/3 are satisfied with the place where they live. And, you know, that gives people a lot of hope to, you know, when we ask about, you know, neighborhoods that are organizing to improve themselves and things like that. There's a lot of positive data in the survey around that aspect of satisfaction with community. One of the exceptions that we see when we look across that data around community satisfaction is neighborhoods with high rates of firearm gun violence and like very high concentrations of child poverty and you know, concerns around public safety. So in the communities where gun violence is high and people are worried about shootings or have been present during shootings, the rate of community satisfaction can be quite a bit lower. These tend to be, you know, small geographic areas, but the ripple effects, you know, can affect entire communities. So for example, in New Haven, you can see on this chart, 41% of adults said they're afraid of being hurt in gun violence. That's much higher than the 4% rate that we see in wealthy towns or 7% in suburban towns. It's not that New Haven has, you know, gun violence, you know, in large areas of the whole city. It tends to be concentrated in like certain neighborhoods and affect, you know, limited numbers of people in like absolute numbers. But if you think about the ripple effects, again, the communities that are affected, the families, the employees and colleagues at work, it's affecting a very large swath of the community. So this data kind of illustrates that even though gun violence, you know, might be not on the list, you know, Connecticut as a whole has probably one of the lowest rates of gun violence in the country, and it's not like a leading cause of death for the community as a whole. It does affect cities and communities, you know, in a very large way. You can see that some of that data here. And to summarize this sort of community level data, I think one of the ways that the DataHaven data is often used is to look at the effects of concentrated poverty and neighborhoods that need resources like grocery stores, parks, public safety improvements. And tables like this are one way to show that. So here we're just comparing like the statewide average for some important indicators in people's life to the North Haven zip code and then to the Hill neighborhood zip code in New Haven, 06519. And you can see just, you know, there's some vast differences in like how people perceive the availability of fresh produce in the Hill neighborhood compared to North Haven. Some of the biggest differences would be like around how many people feel safe walking at night. So in North Haven, you know, 65% of adults feel safe walking at night. In the Hill neighborhood, it's only 35%. So these are large differences that, you know, do affect entire communities, and often this type of data can be helpful for, you know, applying for resources to improve safety or improve parks or other things that communities need. It is helpful to, you know, have these statistics that are very reliable, can be collected in the same way every year, but also give residents a chance to discuss them and provide like some interpretation. So on the parks question, for example, you know, many neighborhoods that do have a lot of parks and such do report lower sense of quality of parks. And, you know, when you ask residents about the reasons why, many residents will say they feel like they can't use the park. So it's like sort of, you know, they're concerned about the safety of the park or the maintenance of the park. So those are important issues to, like, you know, you can start with these statistics, but sort of move towards community discussion and kind of figure out the reasons, and then from there, what improvements would be needed to improve opportunity in these areas. One of the biggest differences is on the bottom of this table. It's the percent of adults who would screen positive for depression. And again, this relates to support from friends and family. It relates to financial stress, and some of the other issues I've discussed. But there's a really big difference here in terms of mental health between the state average, North Haven, and then the Hill neighborhood, where 37% of adults were screening positive for major depression risk in the survey. Again, the data for like individual towns like Madison, North Branford, the smaller towns in the region, it can be accessed through our Connecticut Town Data Viewer. You can go on there and view the statistics for some of these indicators, and also download the data and compare it across different communities. So that's a resource for using it. And then the last thing I'll say, I sort of alluded to this before in terms of having interpretation around the data. I think if you're using this with like your nonprofit board or in your community, it is helpful to have like a historian present or someone with like deep knowledge of the town, of the neighborhood, to provide the historical context, the current policy context around some of this data. A good example is with housing. So, and health, we can see, there's a 20-year difference in life expectancy in the region, and home ownership rates are very different from one neighborhood to another. So some of the data that could be brought in, when discussing this with residents, I think it's really important to have, some of the history around how the city's developed, around industrial lines, transportation lines, where people were able to purchase homes, and also who was able to buy homes. So in many parts of Connecticut, until recently, only white people could purchase homes in certain areas. And that was true across the whole state. And also currently, thinking about where people could live if they have sort of a median income salary, or the zoning regulations in the state really limit apartment construction to very small areas within the state, especially like New Haven and just a few parts of West Haven, a few parts of Derby. Apartments are really not allowed to be built in, the vast majority of the state. So that affects also, if you're looking at the home ownership rate in the community or who has access to housing, those contextual issues I think are really important when using the data, I think with resident groups. So that's all I have in terms of an overview of the results, and I'll stop sharing.
Mark, thank you. Thank you so much for distilling a ton of work into a brief presentation and providing the opportunity for folks to know how to get access to the full range of what you've done here. And I'm seeing lots of applause emojis come up for you, so much appreciated. I want to start with the places that are showing some rays of hope and some signs of real strength in our community. And the findings about how people feel about their community jump out to me, and they stay with me about despite all of the differences that we see across the towns. And you showed a difference between two places that were 10 miles apart, but very different outcomes with the North Haven and Hill example. But when you look across, right, you see a level of satisfaction about people's neighborhoods. I'm curious about how that's trended over time. What have you seen as you've looked at that measure across? Is that stable? Is it improving? Are you seeing any movement there?
Yeah, I'd say for that measure, which is just, are you satisfied with the place you live? It's been very stable over time. It is higher than, when we first started doing the survey, we thought it would be sort of like similar to the national average. It's like, maybe a little bit higher in Connecticut. And when we do the qualitative interviews, the open-ended discussions, people really say like, I just really love living in the such and such town, or if they're part of a community that maybe like you saw that chart with like maybe some of the more marginalized communities or groups that have issues with like accessing food and healthcare. The people from those groups will talk about, the assets of Connecticut or of the greater New Haven region, like having supportive nonprofit organizations, having communities they can rely on, and sort of I guess sometimes bring up the policy context, like Connecticut being a more supportive state for people who have needs like related to incarceration or other issues. So those themes emerge, and I think it shows a lot of positivity in terms of kind of the direction of things, people's investment. Another question we actually ask is whether people like plan to buy a home, and most people say they will at some point if they don't currently have a home. And the vast majority say like they think that home is going to be in Connecticut. So it's not like people are, all saying they're about to leave or anything like that. People are really invested in here and working on improving the neighborhoods, or they see other people around them for the most part improving their neighborhood.
You'll not be surprised that I'm going to come back to housing before I let you go. But as we think about the way that I framed the vision that the Community Foundation holds for the 20-town region as being a place of that is ever more inclusive and equitable and connected and philanthropic. I think about that requires some imagination and some visioning of what does it look like? What will it look like to be a 20-town region where we achieve that? And so I'm curious, when you think about the data, what lift up for us some of the key indicators that you're keeping an eye on, whether that be overall or whether it be the disparities within that? What are you keeping your eye on as the measures of we're moving in the right direction toward equity and inclusion?
Yeah, we like to track like, the data points that are getting better over time and things like that. Unfortunately, with the financial security data I showed, there was kind of a big regression, I would say, the past few years, just with rents going up like 30 to 50%, home prices going up, food prices. So and things like that. We really saw those weighing on community. A lot of people, especially with children, like middle-aged adults, are seeing like somewhat lower levels of satisfaction recently. I think that could be related to the stress and economic issues. But some of the things, another thing we do is look at disparities, like you said. So take the community with disabilities, for example. We can actually look across the survey and see where there's the largest disparities. And there's a lot of intersections between those issues. One of the ones that really jumps out when we do that analysis is transportation access. So again, being able to get around the community. People who are disabled, may in some cases not be able to drive, so they're more reliant on transportation. But if you look at other groups, like comparing men and women, for example, men tend to have a higher net worth and more access to financial resources, and there is that gender disparity in pay and assets, and that's reflected in the transportation data as well. So that's where we see some of the biggest differences, is just like questions like when you need a car, do you have access to one? Or we also have a question like, if you need to get someplace, like to a doctor's appointment, can you get there? And people either say yes or no. And in most of the region, people are able to get around, but we do see some of the biggest disparities are in areas like that. And I think that those sorts of things point a way forward in terms of access and opportunity. Like, I think feeling isolated, not being able to leave your house is a big, is one of the things that's most strongly associated with like social support and with satisfaction with life. It's kind of a common theme that we see across the survey data.
Did you find, I think I heard you mention a few things that were surprising, but what surprised you in these in this year's data, and how does that focus you on any additional questions or areas you might want to interrogate going forward?
Yeah, I mean, one area that was notable was, when we had the advisory council meet and suggest questions and vote on questions like that, question about not getting mental health care really rose to the top. Like everyone thought that would be super helpful, super important. And when we looked at the data from that, we do see, among younger adults, there are just very large numbers of people who aren't getting counseling, but say they need counseling. And some of the surprising data is like when we follow up on that, it's not necessarily due to just like the cost of finding, say, a therapist or getting treatment. It's also just like not knowing where to go for treatment that comes up. So those are some of the things I think that, given that that's such a high priority across, all the people who helped us design the survey, that's something I think that merits further investigation. But yeah, there's such a wide range of topics in the survey, like all of it is potentially interesting, and we do, hope to work with nonprofits and public agencies to, make sure this data is useful, and you think about like other data we can track to understand the situation better. I think particularly with the change in the administration, there are risks to some of these areas, like funding cuts to whether it's healthcare or transportation or other things, funding cuts to cities that take care of our public space, but many other things as well, like the fear in communities around like immigration raids or something like that. We can, in the data, we can see Latino adults are often less trusting of some of the institutions, some of the, sort of have worries around neighbors and police institutions and those sorts of things. So those are things I would also like to track and think about ways to, whether highlighting that data is useful to help address those concerns in those communities.
Well, the use of the data to impact policy is certainly one reason why we think this investment in DataHaven is so important. You were able to so clearly highlight the growing economic instability that families are experiencing. Certainly able to track how housing costs are connected to that, but also so clearly call out points in time where there were federal programs and the trend started to go in the direction we wanted it to go, and how the removal of that program reversed that trend. And as we started the call highlighting the concern about the threat to federal level of funding coming into our community, I think the data that you provide is very useful for advocacy efforts to try to protect some of these things that have been so important. Christina has joined us on the screen, which means we're going to pivot a little bit now and get to hear what's alive in our community. What are the questions that are percolating there? So, Christina, what do you got for us?
Yes, there's several questions coming in the chat. The first I'll offer is on the correlation between post-secondary education and social emotional support. Is this a proxy for financial security or an independent effect?
Yeah, that's a very good question. I think both are important. If we break the data down by income, we see a similar effect as education, but education and income are so closely linked. It almost, maybe it doesn't matter which variable you use. Probably one is, there are reasons for some being more important than others, but I think, it is just concerning to see that difference, both in the local data, but also nationally, and like how often people can go out and visit with friends, or I don't know, there are lots of different ways that question is asked. So I highlighted that as something that, has really stood out over the past few years. I did look by like age and race and other factors, and it seems like it's mostly about income or socioeconomic status. Those other categories are like less affected in that trend. So again, I mentioned like a lot of stress on middle income families with children. So there is some effect there where we see the drop in social supports, like maybe particularly affecting people like in their 40s, 50s with children. That kind of goes back to like paying for food, housing for families.
There's another question here about the survey, asking specific question about the survey. How many respondents identified as non-binary or transgender?
Yeah, that's a good question. So we have a report on the DataHaven website around LGBTQ well-being that I'd encourage folks to look at if they're interested in that. That kind of breaks down some of that data further. In our survey, 1% of adults identify as transgender, and the non-binary percent is, I think, a bit lower than that. It was like about half of 1%. But for the often like for this Greater New Haven data, we can break it down by certain factors. I think to look at transgender community or people who identify as non-binary, we usually use the statewide data set. So you'll see in the other report, just given the numbers are small to really understand that community, you need like such a large sample. So we usually use the statewide data to look at that community.
Then there's two questions here related to community satisfaction and neighborhood. I'll ask the first one because it's about who's included in the data. On the satisfaction with your community chart, I did not notice African American or Blacks included. Is that correct? And if so, why was that the case?
Yeah, so in the chart I showed, I was using that to make the case that, in the DataHaven survey, we collect data for lots of demographic groups that aren't typically included in surveys. So people with incarceration history or disability or other groups. And then Puerto Rican is another example where, typically in surveys you ask, a lot of surveys have asked about race. So like whether people are white, Black, Latino, Asian. So we do that. And then, but we also have more detailed categories like Puerto Rican and also people born versus on the mainland versus on the island of Puerto Rico. And those distinctions, the point I was making is those distinctions are like super important because they are kind of measuring something about lived experience. If you moved to Connecticut recently from the island of Puerto Rico, your experience may be different than an adult who maybe has like second, third, fourth generation Puerto Rican family who has lived in Connecticut for longer. So that's the reason we study those categories. There is in the crosstabs, all the data is broken down for the large race and ethnic groups as well. So for Black adults, Latino adults, and there are really important differences looking by race, especially with regards to questions around like policing and discrimination. And I mentioned assets. So the chart on like net wealth or net worth, there are really big differences there between white adults and adults who are Black or Latino on those measures of like basically wealth and assets. So things like cars, home ownership, having debt or not having debt, those are where we see the biggest differences, I would say, by race and ethnicity.
So you have the data, you just didn't show it. It wasn't in that particular chart.
Mm-hmm. Right.
For the indicator, neighborhood has many places to walk to, 76% in New Haven. What else can you tell us about that response?
Yeah. So the survey we do, it's had like several questions about kind of the built environment or walkability of neighborhoods. And those are some of the areas where, some things we don't expect to change over time. One of the questions is about having places to walk to or having sidewalks. And those numbers stay the same every year because, the environment that people live in, it doesn't change that quickly. Like you either have stores nearby or you don't. Um, we know, across Connecticut, there's some places where you couldn't really walk anywhere. And then places like New Haven where people can walk to lots of places. So they do report that. And that's a positive aspect of communities is just having lots of places you can walk to. So that's the reason it's in there. Some of the changes we've seen, the biggest change is a question on like places to ride bicycles that are safe. And since we started doing the survey, a lot of towns have installed like bike paths and bike lanes. So in the towns that have built more of those, we see a big increase in like how many people say there's a safe place to ride bikes, for example. So those are kind of some of the questions we include in there to measure, how comfortable people are walking, going to places, kind of related to public safety.
There's a lot of questions in here, and there is a question here specifically for Karen, but I want to save that until towards the end. Someone's asking, they apologize if they missed the data, but are interested in data collection around transportation. And what trends did you discover in terms of cost, schedule, frequencies, and age factors in public transportation system in the greater New Haven area?
Oh, that's a great question. So we don't have like a lot of detailed questions about bus schedules and that kind of topic. We have in previous versions of the survey had more questions around that. So there, it's an interesting topic for sure. It definitely affects mobility. What we do is, to try to cover as many topics as possible. The relevant questions we ask are like whether people have to, stay home if they want to get somewhere. Were they able to get where they needed to go, and then including to like healthcare appointments specifically. And then we also ask if people have a car when they need it. So that's, again, you see these really big differences in communities in terms of who has access to a car when they need it. Almost everyone, earning a middle class, middle income, household income says they have a car when they need it. Whereas in neighborhoods with, lower wealth, levels, it's harder to purchase a car. There are a lot of barriers to owning a car and paying for one and that sort of thing. So we see, you know, lots of adults that don't have access to a car in those areas. So that demonstrates the need for better public transportation, for example.
I think it's important to note too that what you were talking about today is actually just a snippet of the data that you studied in the well-being survey. And then there's a lot more data in there. And then when you publish the larger report, you actually include not just the survey data, but other publicly available information, which turns out to be a pretty comprehensive report. There's another question here about child and senior care, and if you have data on that through the survey, how that affects the core issues.
Yeah, we know that childcare, senior care, like just from other data and also from our survey, that it does take up a lot of people's time. So their spare time or their day-to-day use of time is influenced by caregiving, right? So whether it's caregiving for older adults or children, that has a big impact on the time people have. So we would see, you know, if people are delaying healthcare, for example, sometimes they'll cite caregiving as a reason for that. We've also, you know, looked at kind of childcare just more generally and income, and because we know the cost of childcare is really high. So we've looked at that a bit. We know that, you know, if you are struggling to pay for other household expenses, it's really hard to afford childcare. It's, you know, could be $1,000, $2,000 per month just for one child. So that's, you know, definitely a correlation we would see in the data. Senior care, there's probably it's less well studied. There's sort of less data around people caring for seniors. I would say that we have easy access to, but I think it's a really important issue, especially as the population is aging. There are more seniors, more people taking care of family members, you know, becomes more important over time.
And how about food insecurity? How much can you break down factors in food insecurity? Are people asked in the survey what they think could actually help?
So we ask kind of like the standard questions about, you know, not getting food, how often that happens. The questions around like reasons or what people think could be done. Oh, another question we ask is whether people use a food pantry. So those trends are very similar. Like we could see, you know, in some communities, only 2% of adults use a food pantry. Again, 2% could be a large number of people, but it could range, you know, food pantry use might be much more common in some communities than others. So we do ask about, you know, whether people have used a pantry or emergency food service in the past year. That's one of the data points we gather. But in terms of like what to do about it, that's more an open-ended conversation with people who are food insecure. I think yields a lot of like rich information about what could be done there. Like, you know, last time we did a study like that, a lot of people talked about how the benefits run out. Like the SNAP benefit is a main food insecurity support, and it's only so much money per month. So you can buy food on it until say the 15th of the month or the 20th of the month, and then, you know, the amount of money is just insufficient. So people are kind of struggling those last week or two to afford food. So that's a theme that comes through a lot, is just the size of the SNAP benefit has not been expanded. And people will say, you know, it should be kind of keeping up with inflation better, or make comments like that. A lot of people do point out like the importance of having community centers, food pantries, you know, to go to when there's that need. It's kind of, for a lot of people, you know, they might have a stable income, but it can change year to year. A lot of people go through that disruption and you know, with that need from time to time. So that's another topic that people will, you know, mention in the interviews.
And I have one more issue specific question, and then I'll try to get to some of these higher level questions. Someone asked, I think when you're talking about social supports and mental health, if you could elaborate a little more on the major depression risks.
Yeah, so the way well-being surveys have asked around about mood and mental health, you know, we ask about like how satisfied people are with life, how happy they are, do they experience like anxiety, We also ask if they feel down or depressed, which is, that plus another question are kind of a screener that would be used in a clinical setting to screen for the risk of major depression. So that data, like I said, it showed, in some communities, the rate of major depression risk is around 10%. In other communities, it might be as high as 40%. So that those two questions about kind of people's feelings and mood are, one way to measure the prevalence of depression in communities. Other studies, when we sort of cross-tabulate that data on depression with social support and other factors, social support is definitely the biggest, the most strongly associated factor with depression. So people are rarely getting the support they need. They're much more likely to report feeling down or depressed than adults who say they have the support they need. Another big factor is just, financial stress. So those are all things that we know from not just this survey, but many other studies that have been done, over time in the medical community of that, these sources of stress in life, they do lead to poor mental health. And there, many sources of stress out there. I shouldn't say it's just financial security or social support, but there's sort of many other very important factors in mental health that, the survey shows some of those, but it could be different from one community to another.
And here's another good question about that. You gave a good historical perspective as it informs how things look today. But what are the current activities taking place now that you think are going to be a predictor of some of these future benchmarks or well-being indicators?
Yeah, so it can be hard to predict, the future of well-being in a community. But the reason we do the surveys is because, everything affects your well-being, whether it's arts and culture, so this community side, whether it's the judicial side, the enforcement of laws, the trust people have in their police and discrimination they're experiencing in different institutions. So financial issues, all those things affect well-being. So any changes in any of those really could have a big impact on well-being. Kind of depends on how big the change is, who it affects. There are certain changes or policies that might affect some populations more than others. Like for example, there was a big increase in calls to mental health crisis lines this week within the queer community. So there were many executive orders. People are trying to turn the news off, but they're hearing about these regulations or executive orders that basically target very small groups of people. And if you're part of that community, it's that could change your well-being in a large way, it seems. So it's hard to predict exactly what happened, but the overall message is all of these things can have an impact on how well off people are, how well they feel about their lives. And
Right.
it's important to keep track of them.
Thanks, Mark. Before I give the last overall question to Karen, which the question will not be a surprise to Karen for sure. A lot of you are asking questions we just don't have time to answer, and a lot of you are asking questions about where to find some of this data, and that will be in our follow-up email. And also, if you check DataHaven's website, there is a wealth of information there that I am confident addresses some of the questions here. But Karen, to kind of close us out, there's a few questions. One specifically asks about the foundation's steps. Will we take proactive steps to counter the proposed freeze on federal funding that would typically help cities assist marginalized communities? And then there's another similar question about how this data will help inform some of our priorities. So I know you have remarks around those. We've been talking a lot about those things the last couple of days, so I'll kick it off to you.
Yeah, thank you everybody for such wonderful questions. Mark, thank you for such a rich discussion of the findings. And I too am one who spends a lot of time on the DataHaven site digging around. There is a wealth of information there that helps to tell the story of this community, far more than we are able to touch on during this session. You know, and the way I think about the question you asked before you asked me a question is everything we're experiencing today are the results of decisions that were made in the current and and in our history. And so the way our communities look are very much based upon the decisions that were made by folks who sat in positions decades before us. And therefore, everything we're deciding today is shaping what our communities are going to look like for the generations to come, and where we're choosing to invest, where we're leaving the places that are left out, who we're valuing, the folks who we decide as a society has less value. Like all of that is shaping what we're going to look like in the community that we're going to leave. And that's why we're so committed here to creating a community that moves us closer and closer and closer to being that place of inclusion, of equity, of connection, where we feel we may be 10 miles apart from the North Haven to the Hill, but we feel like we're one community committed to each other and committed to each other's success. And that's the energy we're bringing into this moment when we know that nonprofits are dependent on federal dollars that are threatened right now. That's how we feel in this moment when we know that those nonprofits are serving people. This is about people in our community. That's how we feel when we know that executive orders are targeting people, people's very humanity. And that's where we know that in those moments, the foundation is called to do what foundations can do. And that's to bring people together as a convener, to bring people together so that we can learn together and really target our efforts based in real facts, real knowledge, trusted messengers delivering us information. And that from there, we can galvanize the resources and direct the resources into community. There is no way a community foundation can replace the size of federal investment that our tax dollars demand we invest in our communities. And we need to hold true to ensuring through our advocacy efforts that we protect getting those federal dollars into our community. But community foundations do have a role in helping to fill gaps and to help support the organizing that happens around that, to raise the alarm, sound the alarm, and amplify that for others, and to help bring resources in that can help hold folks over while we sort out the bigger issues. That's what this foundation has done well before my getting here, and that's something we'll continue to do in a frame of the way in which we step forward into these issues. There'll be much more to come about how we're going to move forward together. But any place where we know we can accelerate getting dollars into the hands of our grantees who are serving our community, those are the things we're looking to do. Any ways in which we can bring folks together and ensure that folks have the right information to protect themselves, their loved ones, and to protect our communities. That's what we'll be doing. And any way we can help bring the focus of all the community members who have been so generous to this point to the needs of our nonprofits, that's what we'll continue to do. So much more to come. Stay tuned. We're living and learning this with you, and intend to be a continued voice for equity, inclusion, a greater connected community, and a more philanthropic community.
Thank you. Thank you all. Don't forget to fill out the evaluation that will pop up at the end. Thanks for joining us.
Thank you.